It usually starts the same way. You're deep in sleep, maybe dreaming about your younger days, when a sudden, familiar urge pulls you awake. You check the clock. 2:13 a.m. again. You sit up, legs heavy, joints aching, and shuffle through the dark house toward the bathroom. Cold floor on your feet, a sigh in your chest, and once more, that weak, unsatisfying stream. Most men over 60 think this is just part of aging. And yes, sometimes it is. But what if it's not? What if that nightly trip, that slow, frustrating urination, is your body's first quiet warning of something far more serious? Hi, I'm Dr. David Lennox, and if you're a man over 60 or care about one, this message could quite literally change or even save your life. Today, we're diving into the early warning signs of prostate cancer, the symptoms too many seniors dismiss as normal until it's too late. We'll also uncover how simple changes in when and how you drink water can dramatically improve your night and your bladder's health. And before we go further, don't forget, subscribe to Senior Spring Today. We share honest, practical advice every week to help men like you feel stronger, sleep better, and take charge of your health. Let's begin with something no man likes to talk about: prostate cancer. The prostate is a small gland about the size of a walnut, tucked just below the bladder. It plays a big role in male reproductive health, but as we age, it becomes one of the most common sites for cancer in men. Now, here's the truth that doctors whisper, but too few men hear. Prostate cancer doesn't always announce itself loudly. It doesn't come with sharp pain or dramatic symptoms early on. Instead, it often creeps in quietly, hiding behind everyday nuisances like frequent urination or mild discomfort. So let me ask you, have you noticed any of these recently? Slower or weaker urine flow, a sudden need to pee more at night, trouble starting or stopping your stream, blood in your urine or semen, pain in the pelvis or lower back, a strange pressure in your groin. Many of these signs can be dismissed as just getting older, but they might be early indicators of prostate cancer. Even more subtle are symptoms like difficulty maintaining an erection, ejaculation discomfort, persistent fatigue, unexplained weight loss. It's easy to blame these things on stress, sleep, or even medication side effects. But listen carefully. Your body whispers before it screams. Catching these signs early makes all the difference. Studies show that early-stage prostate cancer, when caught soon enough, can be treated with a far greater success rate, often with less invasive approaches and fewer side effects. So why do so many men wait? In my decades of practice, I've heard the same answers again and again. I didn't want to know. It's embarrassing. It's probably nothing. I'm too busy. But here's the thing. Prostate cancer doesn't wait. And the cost of silence can be your life. Men over 50, especially those with a family history or African American men, are at higher risk. That's why PSA blood tests and digital rectal exams matter. Yes, they're uncomfortable. Yes, they feel invasive, but they take just minutes, and they could give you decades back in return. Let's talk prevention now. Start with your plate. Diets high in red meat, dairy, and animal fat? Not great for your prostate. Instead, reach for cruciferous vegetables like broccoli and cauliflower, lycopene-rich tomatoes, and foods high in omega-3s like salmon or flaxseed. And movement? It's medicine. Even just 30 minutes a day of walking, stretching, or light resistance training can improve circulation, reduce inflammation, and help regulate hormones linked to prostate cancer risk. Now about those nightly bathroom trips. I've had patients swear they're drinking less water to avoid waking up, but that's a mistake. Dehydration can irritate the bladder, making nighttime urination worse. The key isn't to drink less, it's to drink smart. Here's the tip. Front-load your hydration. Drink most of your water before 6 p.m. Avoid caffeinated drinks, alcohol, or spicy foods late in the day. They stimulate the bladder. And add magnesium-rich foods like bananas or almonds to your evening snack. They help relax the bladder muscles. And if you're still waking up more than once or twice a night, that's a red flag worth discussing with your urologist. Let's also touch on treatment, because some of you may already be navigating this journey. Depending on your cancer stage and aggressiveness, treatment may involve surgery, like a radical prostatectomy, radiation therapy, hormone therapy to slow tumor growth, in some cases chemotherapy. Each comes with its own set of side effects. Fatigue, urinary incontinence, sexual dysfunction, these are real challenges. But here's the part many doctors skip. You can still live well. Staying active, eating clean, managing stress, and surrounding yourself with community can help maintain your quality of life even during treatment. Talk openly. Ask questions. Join support groups. You are not alone in this. And to every man listening, let's stop pretending we're invincible. Let's stop brushing off symptoms, skipping appointments, or saying, "I'll deal with it later." Later sometimes doesn't come. Real strength is being proactive. Real courage is facing the truth. So if you're over 50, or especially over 60, schedule that PSA test. Talk to your doctor. And please, don't ignore your body's quiet signals. Before we close, here's your simple action plan. Track your symptoms. Write them down. Frequency, flow, any pain or fatigue. Get screened annually, especially if you're in a high-risk group. Hydrate early in the day and limit bladder irritants after dinner. Improve your plate. Eat prostate-protective foods. Keep moving. A stronger body supports a healthier prostate. Speak up. Don't suffer in silence. Share this with friends, brothers, and sons. This is how we protect our future. This is how we break the silence. Thank you for listening. I'm Dr. David Lennox, and remember, your best years can still be ahead. Subscribe to Senior Spring today for more trusted health tips, proven longevity strategies, and stories that empower men like you to thrive. Because your health doesn't end at 60. It begins again with clarity, courage, and a choice.